Congressman Phil Rowe joins us by phone now from Johnson City, Tennessee. Congressman, it's good to have you with us this morning.
Great, thanks for having me on.
So the head of the Red Cross says the travel bans are not the solution and called the idea irrational. I want to put up on the screen what the president of the World Bank said. It's as if you were in a burning house in your room and you start putting wet towels under the door to keep the smoke from coming in. You think a travel ban is a good idea. Why?
That's a silly analogy. First of all, let's just go back and not look at this. I mean, the way I look at it is the way I was trained in medical school and taught medical school. Outbreaks, the way they work, if you have a group of people, a room full of people who are immunized, and someone comes in with the disease, they can't get anybody the disease because everyone's protected. If you're in a room where no one has the disease and someone comes in, and that someone contacts the person who's not immunized, you quarantine and isolate those people. It's worked for centuries. We've known how to take care of epidemics, and the evidence is apparent in what's going on in the United States. If we had had a travel ban, you would not have had a single original case of Ebola in the United States, not one. Now, can we handle an epidemic in this country? Absolutely. And Dr. Spencer, who contracted Ebola, taking care of patients in West Africa, I want to thank him for going and doing that. I mean, those of us medical people, like I was for 31 years practicing medicine, are on the front lines. And this is a very skilled physician who used precautions and still got the disease, as the two nurses did. So once you're infectious, that is a highly, highly infectious disease and highly lethal disease. Now, fortunately for those folks, they appear to be virus-free, and hopefully Dr. Spencer will be.
Congressman, I hate to interrupt, but I want to get specifically to the proposal of the travel ban. You say that people who are in Sierra Leone, Liberia, and Guinea, they should not be, of course, traveling to the U.S. That's the heart of a travel ban, but it assumes that they can't go to a neighboring country and then get into the U.S. Doesn't this travel ban, if it's enacted, encourage people who want to get to the U.S. to be evasive?
Well, you still have when I have a passport and I travel, I have to have a visa to the country I'm going to, so we know exactly where your point of origin is. Let me also say that the U.S. military is doing exactly what I just suggested and what we wrote the president this week. They're going to keep their troops that have been in the West African countries to help, and thank goodness they are, for 10 days, and then quarantine them for a full 21 days to make it a full 21 days once they get back. And they're going to make sure that they don't have Ebola break out in their troops. And I think that's a smart thing to do.
So I want to get your response to what we're seeing in New Jersey and in New York, this requirement for healthcare workers coming back who had, of course, contact with Ebola patients coming to the U.S., this 21-day mandatory quarantine. I did not hear what mandatory means. Of course, I know the definition of the word, but are we expecting them to go and visit these people every day? And for someone who I know is a fiscal conservative, that seems pretty expensive.
Well, let me tell you, it's very inexpensive compared to the cost of treating this disease once it gets in. Let me give you an example. Just a hazmat suit. I talked to some hospital officials. It's about $200 to suit up, and by the requirement, CDC and the way we should be treating these patients, you go in with two people so you can observe each other. So it's very expensive, and hospitals around the country already have spent millions of dollars preparing for this, buying equipment that they otherwise wouldn't have. My local hospitals in Johnson City and Kingsport, Tennessee, have already spent tens of thousands of dollars, plus the training that's required to uptrain our staffs.
All right, Congressman Phil Rowe, we appreciate you talking with us this morning.
Thanks very much for having me on, and I hope and pray that the folks that are infected get well, and certainly I hope we restrict the travel so that Americans don't have to worry about the disease spreading here.
Thank you, sir. Allison?